So Doc, let's start with you. How common is it for women to be concerned with this and take steps to preserve their fertility?
So it is somewhat common, although again, I go back down, particularly in breast cancer, to the statistics. It's only less than 5% of the patients are less than 40 years of age, and the vast majority already have a planned, a child and a planned family already. So even younger females, a great proportion of them have had kids already, and
right.
when they face this, they decided not to do it. But it still is a substantial amount of patients. Obviously, in the pediatric population, if we expand this to other cancers, it is way much more common. No?
Right.
And so, but yes, nowadays we're seeing it more and more. There's more awareness about the topic.
Wonderful.
And I think it's a very important one, particularly in a young female that has not gotten the child.
Very important. Now, let's take a look at some of the different cancer treatments. So can you tell us how these cancer treatments affect fertility individually?
So yes, so again, these are the types of cancer treatment as a general terminology. What it means for, let's say, breast cancer care is surgery to the breast. It won't create a problem as far as infertility. And so chemotherapy for sure, in the sense that it can, the medications that we use for chemotherapy can affect the ovaries in the sense of, killing the eggs. Remember that females are born with the same amount of eggs that they carry throughout their life. It's just that they get to be mature. So there's not a replacement of them after chemotherapy. That doesn't mean that every single chemotherapy agent will do it. That doesn't mean that everyone that gets exposed to chemotherapy will happen. Radiation, the same applies. Although
which is what in Clara's case, she had radiation.
Absolutely. We feel very safe about that component, despite the fact that we did in vitro fertilization, that radiation to the chest wall area should have less impact on, like compared to, for example, radiation to the pelvis. Whenever we use radiation to the pelvis, and radiation again is a technique that is very localized. So we're doing radiation to the breast, we're focusing on this area right here. But when we're doing radiation to the pelvis, let's say for cervical cancer, that's a topic that becomes way much more important. And then obviously anti-hormonal therapy, when we are trying to lower the estrogen, that has, for example, tamoxifen, which is one common medication used to prevent recurrence of breast cancer, has teratogenic effects on babies, so birth effects on babies. So we cannot safely try to get pregnant while on these medications are going.